This is Heart Rhythm TV, and I am Julie Shea here with a 2024 AP Council update. With me here today, I have Dr. Martha Ferrara, who's a nurse practitioner and assistant director of electrophysiology at White Plains Hospital in White Plains, New York. And Martha is the AP Council chair for the allied professionals. So welcome, Martha. Glad to have you here today.
Thank you so much for having me, Julie. Always a pleasure.
Yeah, so I understand that you did a presentation for the Board of Trustees at our annual meeting in May of this year and kind of presented an update of what the allied professionals have been doing over the past year. And I was wondering if you would be able to share that with the AP community today.
Sure, my pleasure. It truly has been an honor for me to have been selected as the chair of the Allied Professional Council, or the AP Council. I had the pleasure to deliver this presentation to the FHRS Board of Trustees at this year's scientific program in Boston. And everyone's welcomed to the information in this presentation. We're happy to share it. But here are some of the things I presented: a brief allied professional history and the work we have been up to for the past couple of years. Allied professionals comprise 25% of the FHRS membership. We are a diverse community of nurses, techs, scientists, pharmacists, and physician assistants, to name a few, with over 200 members from countries around the world. And 86 of us have earned the prestigious Fellow of the Heart Rhythm Society designation. We wear that proudly. Allied professionals have been part, and indeed, we have been foundational members of the Heart Rhythm Society. Visionary allied professionals who recognized a need within FHRS for the education of allied professionals in the field of electrophysiology. They were instrumental in the creation of the Council of Associated Professionals, or CAP. Jennifer Frazier, nurse, was one of the authors of the CAP guidelines, providing a framework for the education of allied professionals working in the field of EP. Many, many milestones have been achieved since. In 2019, the current iteration of the AP Council of this AP Council was launched. I follow in the footsteps of our first Council Allied Professional Chair, Julie Shea, which is a truly great honor for me, Julie, on a personal level. I find you to be one of those heroes I look up to when I think of the Heart Rhythm Society and allied professionals. Thank you for all the work that you always do for our community. Allied professionals, we have continued to do meaningful work throughout the years. Aileen Ferrick is the section editor for the AP Case Reports in the Heart Rhythm Case Reports Journal. This is extraordinary and an innovative platform where APs can publish their workflows, we can publish our challenging cases and solutions that we find. Carrie Harvey also helped launch the AP Publication Fund to reduce financial barriers for APs to publish their work, raising over $11,000, which is remarkable. It's remarkable work. A unique initiative has been the AP series on research, or the 101 webinar series. A fantastic, absolutely comprehensive presentation over several webinars by AP experts in research. A debt of gratitude to our distinguished APs who offer their time and their hard work to bring information for APs in demystifying research, and encourage us and encourage our publications of the great work that we do every day in our clinics, every day. Please publish your data, APs. Publish your data. Christy Coleman, BSN. Carrie Harvey, PhD AP. Aileen Ferrick, PhD AP. And Lyle Larson, PhD Certified Physician Assistant. We are incredibly grateful for your terrific efforts in continuing our legacy. The AP Journal Club has been a very successful initiative since 2021, that is going pretty strong, averaging about 35 HRS members per session across various career stages. All are welcome to join. All are welcome to hear the presentations and the discussions that we have. We choose our topics, we vote on the choices, and we have robust discussions on what is important for the work that we do. At our annual scientific conference this year, there were over 1,000 allied professionals in attendance, 55 allied professional focus sessions, 19 AP poster presentations, and backed by popular demand this past scientific session was the AP Lounge, front and center, greeting members from around the country and around the globe. It was a wonderful feeling. It was wonderful to be there and be part of. There were 9 sessions over the entirety of the conference to address allied professionals' growth and interests. So you may wonder, well, who is the Allied Professional Council anyway? We are HRS members who participate in committees, working groups, and task forces. We are you. I know, sounds simple. We are you. Our objective is to support the HRS mission by facilitating communication, organization, networking, and mentoring within our AP community. Many of us are alumni of the Leadership and Education for Allied Professionals program, or LEAP, carrying on the educational traditions started so many decades ago by our visionary members.
Martha, thank you so much for that tremendous overview. It is, when you kind of collectively put it all together, it's very impressive what all of the members, the allied professional members of the Heart Rhythm Society accomplish on a day-to-day basis, whether that's, you know, at the workplace or on a more national level through the Heart Rhythm Society. They bring so much to the field of electrophysiology. So thank you for your overview. So let's talk about where we go from here. What do we have on the books for 2025 coming up?
It's a really good question. You know, we have continued the work that was started years ago by many of our current AP Council members, the Allied Professional Leadership Framework. It's an ambitious initiative that aims to establish a process to identify and mentor emerging AP leaders so that we can enhance communication and collaboration between the Allied Professional Council and HRS leadership and support the society's strategic plans. Our goal is continuing to grow strong AP community leaders and also the next generation of allied professionals so that we can carry on the mission of caring for patients who suffer from cardiac arrhythmias. It's a pretty ambitious endeavor and initiative, but we're all up for the task, Julie.
Yeah, no, I think, you know, we've now graduated 3 classes from the LEAP program, the Leadership and Education for Allied Professional program. And, you know, I think it's nice, it's kind of a perfect fit to start to develop this leadership structure or framework so that we can, you know, move people up the ladder, people that are successful and, you know, kind of moving the needle in the field of cardiac electrophysiology. So I'm excited to see where the framework goes. I think it's important to provide for transparency, important to provide for diversity of the workforce as well. So kudos to you and the Allied Professional Council for moving that forward.
Thank you.
And one other thing that we can talk about here is coming up shortly is HRX, the Innovative Digital Health Program. Do you want to talk a little bit about that?
Sure. I also wanted to mention that for the next year for the AP Council, we will continue to work on the research webinar series. Mm-hmm. So that would be, webinar 102. And I think it's in keeping with what we are trying to accomplish at HRX, where I know it sounds trite because we've heard that before, but it's a unique conference. You know, it's a unique conference where we are bridging the next generation of allied professionals that will mingle with industry, will mingle with physicians and other professionals, all other allied health professionals, in trying to just bring a little more cohesion to to the way that care is being delivered in the 21st century. So I am excited for it. I think it will continue to go for many years as technology changes very rapidly. And we need to address the gaps on how to bridge what we know we've been doing for many decades to what is coming up next. And allied professionals being, again, part of this FHRS technology meeting that is sponsored by FHRS, it's so unique in the inclusion that occurs just naturally for FHRS. I'm proud to say that I was the allied professional who opened the inaugural FHRS conference, and I will wear that proudly and take it with me in my retirement many years from now, because it was such a wonderful, positive, and invigorating conference and feeling and environment to have that I think it's a little addictive, and I want to be at it every year. I hope.
Yeah, I mean, it really is an exciting program. I mean, very different than what we're used to, in terms of like the annual meeting. This is a much more kind of, free flowing of ideas, having roundtables, having panel discussions. So less slides, more panel discussions, a lot of interactions, industries right there in the room with us. So very exciting. And as allied professionals, we're innovators every day. We figure out how to do things more efficiently and more effectively in our workplaces. And I think that we provide an important structure for the whole program based on that. So thank you so much for providing us with this update from the Allied Professional Council for the 2024 year, and you're going to be the chair for the upcoming year, I understand as well. So we will look forward to another update next year, and we hope to see all of you at FHRS.
Thank you.